name is Matthew Chow. I was president of Doctors of BC during one of the most incredible years faced by a healthcare leader in history. But more importantly, I was a witness. And I used to have a mustache. A witness to the people I will feature to you tonight by way of my personal vignettes. For some, I hope we will honor them, and the others, I hope we will give them the space to grow, to thrive, and to lead. Bonnie needs no introduction. Let me tell you about the time I private messaged her during a meeting to thank her for her service, for everything. And yet she had the temerity to turn it around and thank me instead. Be kind, be calm, be safe. That's Bonnie for you. Reka, Patty, and Penny. Behind every strong leader is a strong supporting cast, and you could not have a stronger cast than these strong women, each of them a leader fully in their own right. They put in more hours than you will ever know, and they did it without complaint. Danuta and her team helped convince Canada to increase the interval between doses of COVID-19 vaccine at a time when supplies were desperately short. In doing so, she saved many lives, but at great personal cost. For months, she weathered attacks, but in the end, she was right. Shannon and Nell, the dynamic duo of medical health officers of the First Nations Health Authority, Indigenous people, having survived pandemics since time immemorial, survived another because of people like them. Will we listen so that we don't have to go through this again? Evan and Danielle, two deputy PHOs, one for the country and the other for our province, both wise far beyond their years. I learned from one that there is much more to health than Western medicine, and from the other I learned what it is to be magnanimous yet forceful, a true gift. Carol and Michael, Twitter has been a hostile place, especially for public health physicians. Carol and Michael have bravely stayed online for 2 years, bearing the slings and arrows from all directions to put the public in public health. Their struggle speaks to the future of civic discourse. Alex and Ariella, two medical health officers responsible for the largest school districts in the province, representative of all the people who kept our children safe. They stayed strong and true to science, despite inboxes laden with hateful mail. They cared about our kids. Jason, Veronique, and Sandra, there will always be people hard at work contributing to our success that you won't hear about. These colleagues were part of the supporting cast, leading in their own way. Watch out for them, because COVID-19 was just a tiny part of what they can do. Watch them spread their wings and fly. Ashley and Rita. The story of the last 2 years is the story of working women everywhere. These are two working moms who taught, wrote books, and put out original research, even as schools closed down and people got sick. Try doing all that in a normal year, and you'll see why they are special. Hasina. Speaking of research, this force of nature put it out in quantity, influencing the pandemic response, providing critical insights to schools, and shining a bright light on the health of children. She's a parent too, and I know it took a toll. For working moms everywhere, I want things to become easier. Barinder, my multi-talented friend, global news medical correspondent, musician, and family doctor. He and the South Asian COVID task force cut through the darkness and convinced many people to get vaccinated. There are many different kinds of misinformation online, and he dispels them all, despite the personal toll. Kathleen, she was my predecessor at Doctors of BC, and I'll never forget the time she texted me during a hailstorm while she was giving COVID vaccines in an outdoor tent. That's Kathleen, leading from the front. She's headed to the Canadian Medical Association as their next president to lead from the front once more. Renee and Rummy, leaders of BC Family Doctors and Doctors of BC. There is nothing these two women cannot do. Organized medicine has not seen a duo like them before, and they will not be the last. Changing cultures, especially medical culture, is hard work, but it is made easier when many hands help. Lawrence, medical officer of health for millions of people, and yet responding to my messages at 3 in the morning. He reassured tens of thousands of healthcare professionals across the country, and one very grateful medical association president. I wish him well on his next adventure as CEO of the College of Family Physicians of Canada. Amin, he is the first turban-wearing Sikh to sit as a member of the BC provincial legislature. He has been open about his struggles with mental health and addictions, and he has also had cancer during the pandemic. I remember how generous he was with his time. I hope all our political leaders, present and future, can be so vulnerable. Paul, ever the provocateur and the person behind Generation Squeeze, we should listen to what he says about younger generations. Our social contract was broken even before COVID and now is in need of repair. He is not a lone voice in the wilderness. Our future depends on bringing the generations together to build back better. There are so many more people I want to tell you about. I presented mostly doctors, but only because that was the group that fate let me to lead. There were heroes from all walks of life, most of whom will never call themselves that word. I hope you will ask me about them sometime. These have been incredible years, matched only by these incredible people. Let us honor them. Let us give them the space they need to shine in the years to come. Thank you.